Hello, everyone. My name is Robert Bednars, and I am a junior doctor in Dundee, Scotland, and you're listening to the Patient Will See You Now podcast. I have to say, this podcast is for educational use only, and you should not be using this as medical advice or opinion. Please go see your doctor if you have any medical questions. This podcast is supposed to be fun and educational. So now that I got that out of the way, let's get into this week's topic. Hey everyone, this is Robert, and on this week's topic, we're going to be talking about cystic fibrosis. Cystic fibrosis, or just CF, is a genetic disorder that mostly affects the lungs, but can also affect the pancreas, liver, kidneys, and intestines as well. Usually, you'll have more of the intestinal pancreatic symptoms as a child, and then the pulmonary issues as you grow older. Unfortunately, cystic fibrosis is a terminal disease, and most people with it usually live to around an average of 37 years old. CF is also an autosomal recessive genetic disorder, which means that the gene has had to have come from both parents who are carriers of the mutated gene in their DNA. So that just means that they don't show the symptoms of it since they still have the normal gene as well. Then both of those recessive genes will be passed on to the child, and then the child will end up with CF. That's usually a 25% chance if both parents have the recessive gene. The mutated gene affected affects the CFTR protein, which can be found in our intestines, pancreas, and lungs. This is the bit where it gets a little bit sciencey. In our body, we have a bunch of different electrolytes like sodium, potassium, magnesium, chloride, and more that are found inside our cells and in our blood. The CFTR protein, also known as the cystic fibrosis transmembrane conductance regulator, we use a lot of acronyms in medicine if you haven't realized this yet. And it's a channel protein that in healthy people help push chloride ions, which are negatively charged, from inside the cell to outside of the cell into secretions. Our bodies tend to try to keep a balance of these charges, so these negatively charged chloride ions are usually accompanied by the positively charged sodium ions. That's why when we give fluids to our patients in hospitals, it's usually in a saline bag, or also known as sodium chloride, which is just salt. Now, with sodium, water will always follow sodium wherever it goes, and that's important to remember for this. To put it all together now, when chloride leaves the cell into a layer of mucus secretion that can be found in the pancreas or lungs, sodium will follow it too, along with water, thinning out the mucus secretion for the organs to function normally. Now, we'll take that CFTR protein channel and take it away. And what happens? There's mucus building up in the lungs and the pancreas. No channel means no chloride can get out to it, meaning no sodium and no water following it, leaving you with a very, very thick mucus secretion causing many problems. When the mucus gets too thick in the pancreas, for example, no digestive enzymes can be released into the intestine, making it impossible to digest proteins and fats, which will make the intestines fail to absorb all of these nutrients and fat soluble vitamins like vitamins A, D, E, and K, and a person can end up malnourished and also end up with some fatty stools coming out. When the pancreas gets blocked up by the mucus plug for a significant amount of time, it can cause damage to the endocrine functions of the pancreas, which, if not managed correctly, can cause a person to have diabetes since no insulin is being produced by the pancreas. Later in childhood, they can start having some pulmonary or lung problems. Mucus secretions are also made in the lungs, which are there to help trap viruses and bacteria. And then, since it's not normally so thick, the tiny, tiny hairs we have in our lungs can move these bacteria filled mucus secretions to the trachea so we can cough them out and keep ourselves healthy. When this mucus becomes too thick to move, however, bacteria and viruses will stay in the lungs, causing some really nasty infections. If severe enough, sometimes bacteria can be covered in so much of this mucus slime that it makes it very difficult for antibiotics to reach and destroy the bacteria there. If the infection becomes a chronic bacterial infection, it can even slowly damage the lungs, causing some bleeding and sometimes make people cough up blood as well. The more you get these infections, the more it will damage the lungs and make it harder and harder to breathe, causing a respiratory failure, and is the most common cause of death in a cystic fibrosis patient. Those are usually the main issues for a person with CF, but it can also cause infertility in men, nasal polyps, and digital clubbing. And I don't mean going to a club and partying. Clubbing is when the tips of your fingers start to swell up. Diagnosis is usually done in newborns after doing a specific screening test for CF, which detects a pancreatic enzyme in blood, and also a sweat test. So I keep mentioning earlier how chloride can't leave the cells into the secretions, but on the skin, it's the opposite, and it's usually the chloride that's on the skin and can't get into the cells. Because of this, parents who are kissing their babies may sometimes say that their baby tastes really salty. That's because of all the sodium that's on the skin as well. And we have a specific sweat test, which measures the amount of chloride is on the skin and is diagnostic for CF. There is no cure for cystic fibrosis, so treatment is just to manage the symptoms. For the pancreatic side of CF, we give people enzymes that the pancreas can't release to break down the proteins and fats so that the patients don't end up malnourished. We also make sure we give them some extra calories so that they have enough nutrition in their body as well. When it comes to the chest, there's some physiotherapy that really helps people with CF, and it consists of someone else cupping their hands and then banging on the person's back to loosen up the mucus in their lungs and then help them cough it up. Some people use a vest, like a pneumatic vest that they put on their chest, and it works essentially the same way. People with CF also use inhalers that have saline in them or sodium chloride to help break down the mucus and thin it out as well. There are also medications that help break down the mucus called Dornase alpha. And then there are now new medications that are personalized for CF patients that help bring this mutated CFTR protein to the surface of the cells, clean it up so it looks almost normal, but will somewhat function and open those channels. There's this really new drug called Trikafta that's really popular in the United States, and it's really helping out a lot of people who have CF. There's been some really great results with it so far. And if all of these methods fail for the lungs, then the person will have to ultimately be put on the list to get a double lung transplant. Before we go on to the guest, after the interview was recorded, I was doing some more research for CF and I stumbled upon a movie called 5 Feet Apart, which stars Cole Sprouse and Haley Lou Richardson. And it's about two young teens who have CF and fall in love with each other. If you're into movies like The Fault in Our Stars, I'd recommend this movie as well. And it can also show how people with CF can affect them mentally just as well as physically. Now we'll talk to James, who I've had the pleasure of speaking with, and talking all about his journey with living with cystic fibrosis.
Hello.
Hey, good evening, James. How are you?
I'm good, thanks yourself.
I'm doing all right. So this is Robert from
Good.
the Patient Will See You Now podcast.
Yeah.
Today we'll be talking about cystic fibrosis, and earlier I mentioned and explained a little bit of what it is about. And usually when I talk to my guests, I usually ask them, when do the symptoms start? When did they occur? When
Yeah.
did you feel something was different? But in your case, for cystic fibrosis, it starts as soon as you were born, pretty much, right?
Yeah. Yeah. Yeah.
So how about we can start, I guess, how were you diagnosed immediately? And then
Yeah.
we can
Yeah.
just go on with how the symptoms started to occur, what things were coming about, and we'll go from there.
Okay. Yeah. So I was diagnosed at 5 weeks old. So growing up, I didn't really know any different. The whole having cystic fibrosis was normal for me because I'd not experienced life without CF. So the whole growing up with it was not a massive issue for me mentally because, like I said, I didn't know any other way. Symptoms when I started to notice a few things was I'm big into sport and I played sport all my life with cricket. So when I would say 10 to 12 ish, that's when fitness started to become a lot bigger with my teammates. But then I was okay, but then occasionally, if I had a bad day, I was having to opt out of a few things. And then as I've got older, it's got a lot harder with the fitness side of things.
So you were let's start from the earlier on when you were from 5 weeks old, and
Yeah,
obviously you don't remember any of it. And I'm sure that's what
no.
your mom probably told you. So what was it for them that made them think that, oh, you have cystic fibrosis? Do you know?
I don't know exactly, but all I know is so I was born and then I was out of hospital quite quick as I was quite healthy. But then within that 5 week period, I lost a lot of weight quickly. And that was alarm bells. So I went back into hospital, and that's when they did a lot of tests, like injections and testing everything basically to try and find out what it was. And then I had a sweat test, it was called,
Hmm.
and that was what diagnosed me with the cystic fibrosis.
And then
Yeah,
from your early, and let me just really quick, how old are you now currently?
I'm 28 now.
28. And when
Yeah,
you were young, so before, let's say
yeah,
before 10 years old, how were
yeah.
you medically then? How was your weight? How was your breathing? How was that going on?
So breathing side of things was very good. I was always quite a healthy boy as I constantly involved in sport. My height and weight was always a bit lower than normal. I'm only 5'7" now, so I'm not the tallest of guys. But as a child, you can mostly imagine I was always shorter than all of my friends, and my weight was always a lot lighter than my friends as well. So that was the kind of points that you could say that is the difference. But regarding my chest, I was always blowing 80s and say 70s and 80% in the spiro test, where now over the years I'm 28 now and I'm down to 36%. I think my last one was. So yeah, over the years it's slowly declined.
Uh, but when you were 10 to 12, I know that one thing
Yeah,
for cystic fibrosis that really helps is just exercise in terms of the
yeah,
chest side of things. So that's really good. So when you were doing all these
yeah,
fitness things when you were 10 and 12, did it become
yeah.
more strenuous? Was it really difficult, or was it more like, oh, this is helping me breathe better? How did that look like?
Completely. It was more the helping side. Um, at that age, I must have been playing sport every day after school. My mum would be ferrying me around from different sports clubs. So over the period of time, definitely a massive boost to my lung function. Um, and yeah, at that time it was quite easy. It's only as I've got older that I found it harder.
So would you say the main thing that's bothering you now is more the chest side of things more than the gastro side of things?
Yeah, definitely. So 3 years ago, I had a pneumothorax and I punctured my lung. So before that, my spiro was around 50-55%. Puncturing my lung with the pneumothorax, it's gone down to say 35, and I've just never been able to get above 40 since I had the pneumothorax.
And but the pneumothorax has been corrected since then though, right?
It has, yeah. I can't remember what the exact term is, but it's when they through the chest drain they put a like a powdered dye glue
Hmm.
through it. I'm not sure the exact terminology for it, but yeah, so it stuck the lung back up, and touch wood, I've not had any problems with it recently, and that was 3 years ago.
So, and then let's talk about the gastro side of things. How is your weight keeping up now? How is your um are you keeping up with vitamins? Are you being nourished all right? How is that picture looking like?
Yeah, so I currently take vitamins A, D, E, and K. So I'm on quite a few of those. My weight is stable. I do pick up, I seem to pick up a lot of sickness bugs recently. So when I get that, obviously I lose a lot of weight, but I'm able to put the weight back on over a period of time. So for me, my issues are more with my lungs, not my bowels, etc.
But just before we get to your chest, just a little bit more of the gastro side of things. Just because you're taking all these vitamins like A, D, E, K, because those are fat soluble vitamins, and fat is
Yeah,
not breaking down correctly since you're not getting
yeah.
the enzymes from the pancreas. Do you notice changes in, let's say, your stools? Is it fatty? Is it very mucusy? Like,
That's a good question, actually. I've not noticed any changes clearly. My doctors constantly check them and make sure that there is no issues. And I, I, when I've been in hospital, I always do check them because I know that obviously different medicines can affect them. But no, I've not noticed any changes recently.
and with the vitamins that you're taking, have you ever experienced symptoms of a deficiency of any of those vitamins? So, for example, for vitamin A would be like night blindness. Vitamin D would be any bone issues. Vitamin K would be bleeding issues. Anything like that?
I am on a bone tablet, so I presume that that could be linked. So I take a tablet called ibandronic acid, which I take once a month. So I'm guessing potentially that there could be linked with my bones.
So now on to the chesty side of things about your lungs and
Yeah.
everything. This is where usually is the bigger mess as you get older. Can you explain, were there any times that you were rushed to the hospital for any reason because of the cystic fibrosis?
Yeah. So a couple of times. One was the pneumothorax. I was actually playing cricket at the time, where I felt a twinge in my chest, and then my breathing went really heavy. And I thought, oh, I've just pulled a muscle. So I actually played another cricket match the day after, and that was when I realised that actually something's wrong here. And then that day I was taken into hospital, and 3.5 weeks later was when I came out. So that was one of the issues. Another issue was I was actually ambulanced in, blue lighted. I had the flu, gastroenteritis, and a severe chest infection all in one go.
Oh,
So my saturations were down to 83. I was on constant oxygen. Yeah, I was in a very bad way. I had to have 4 liters of 4 liters of fluid put back in me as I was very dehydrated. So yeah, that was not a pleasant time at all. So I've only emergency gone in twice.
how old were you when that the triple attack got you with the gastroenteritis and
Um,
everything?
I would say about 25.
When those happened, what is your feeling like? Because 25 is obviously you're old enough to understand what's going on.
Yeah,
Do you
yeah.
feel like oh man, this is it? Like when you get attacked with these flu and gastritis and everything, or what are you
Um,
thinking?
I feel like, oh, it's hit me again, kind of thing. Like I've had sickness bugs and the flu quite a lot because my immune system is so low. So I do pick up bugs quite often. Um, that day, I did think that this is a lot worse than previous times, but I was out of it too much to really worry about anything. I was just wanting to sleep, but it was my mum and dad that were kind of contacting the ambulances, making sure I was taking fluids on board, just making sure I was awake as well. But yeah, I was in there for just over 3.5 weeks again that time, I think.
And you were just on IV antibiotics and just fluid therapy the whole time?
Yes, I was on IV fluid, IV paracetamol, and then normal IV antibiotics.
Hmm. So besides the emergency admissions that you had to the hospital, do you
Yeah.
normally just see a doctor, I don't know, how often a month that you would?
Yeah, so once a month I'll go over to the hospital and they'll check me out. I'll do a spiro test, see the dietitians, and then if I'm needing to go into hospital, then they will admit me from there. Actually, today I've had a nurse come and visit me instead of me go to hospital, which was a lot better because the hostel's over an hour and a half away from me.
So they were able to set you up with a nurse that comes in, and what does that visit
Yeah,
look like?
so so literally my specialist nurse just comes to my house. She will do a examination of my lungs using a stethoscope. I have a portacath in my arm, so they flush that, and then just a general chat, really, just to see how I'm going, how I'm coping, how I'm doing with any new medication that I might be on, and then I'll go next month, which will be the 14th of January, where I'll go back to the hospital and I'll have a spiro test.
And what is the aim with the spiro test now? Because obviously, I don't know if you'll be able to ever get back up to 90% again unless there was a drastic change. But what are they usually aiming for? When do they say like, oh, these are bad numbers or this is okay for you?
Yeah.
What does it look like?
So when I had a pneumothorax, I lost about 30% of my lung function. They now, obviously, the spiro works alongside the physios, and they've got to the conclusion that between around 40% is is my best, and I'm at a healthy lung function there. So between 35 and 40, they're happy with. Anything below 35 is I kind of need IVs or oral antibiotics.
Now, I know that physiotherapy is also a big help when it comes to cystic
Yeah.
fibrosis patients. Do you often see a physiotherapist? Does one come to your house as well, or
Not to my house. When I'm in hospital, I have physio every single day. When I'm at home, it's kind of nebulizer driven. So I have two nebulizers in the morning and two nebulizers in the evening. In between that, I have something called a PEP. Have you heard of the PEP?
I don't think so. If you can explain it.
It's it's like a small. It's literally about what 4 inches long. It's a very small device. You blow into, and it's similar to the flutter valve and the acapella. It sends vibration into your chest. So I will do that twice a day, sometimes 3 times a day, alongside my nebulizer, and that's kind of my physio. And then I try have a bit of a walk, a bit of exercise.
So actually, so how does this work? It's 4 inches long, this PEP, and then
Yeah.
I don't
So
understand.
if I'll blow into it, I've got it in my hand now. I'll blow into it. So can you hear that?
Yeah.
It's like I'm blowing into a small pipe, and it's got a resistance within the pipe that will hopefully open some airways in my lungs and send a small vibration into my lungs and my airways.
Oh, okay. So no, I never heard of this before. I was thinking of something completely
Yeah,
different. And do you feel like that helps you whenever you do it, or
yeah,
yeah?
definitely. So I've had previous devices that are quite similar, but this I found has been the best one. It's mostly the simplest, but it's been the most effective.
So do you bring it around with you as well?
If I was to stay over anywhere, yes, I would take it with me. It's very portable. But most of the time, I just leave it at my house. I'll do it first thing in the morning, and then in the evening, I will do it again. Just like I can sit in front of the TV and do it for 10 minutes.
And with the nebulizers, what is there any medication or is it just sodium chloride in the nebulizers?
No, no. So I take at the moment um, Promixin. Have you heard of that?
Not off. I can't remember off the top of my head.
Yeah, so Promixin and Tobramycin,
Hmm.
but I take Promixin for 1 month, and then I'll stop and I'll take Tobramycin, and then alternate the months. And also Dornase Alpha, which I'll take as well, twice a day, every day.
Yeah, and that one breaks down the
Yeah,
mucus that you have, and so you do. I think you said two nebulizers in the morning and
yeah,
two in
two
the
in the
evening.
morning and two in the evening.
What does
Yeah.
that mean? Two. Like you do
So
two
I'll
sets of an hour, or
no. So I will do say pro mixing, which will take me about 5 minutes to complete cycle. Then I'll do my PEP device, and then I'll finish off with the Dornase Alpha through the nebulizer again, which again is about another 5 minutes. And then I'll repeat that process in the evening.
so it's not a very long process. I thought it would be a much longer, like an hour
No,
long or
no, it
something.
takes to do the two nebulizers and the PEP device, it takes me about 20 minutes to half an hour maximum.
So does this kind of affect your life of going out to hang out with a friend and sleep over or going on vacations? Do you have these with you, or how does that look like?
Sometimes I'd have to plan staying over elsewhere. It's not something, if I'm already out, all my medication would be at my house. So I'd have to plan going elsewhere. The PEP and my nebulizer, I use the iNeb for the pro mixing, which they're both handheld, so they're very portable. So I can take them within a small bag and yeah, very portable. Take them abroad, take them to my friends. For instance, Christmas Eve, I'm staying at my parents' house, so I'll take them over there.
That's actually very cool because
Yeah,
I'm usually based in a hospital setting, so when I see nebulizers, it's just like a big oxygen machine, and
yeah,
they have to lay down.
completely.
So that's really nice. That's portable for you. You can bring it with you
Yeah,
on vacations and stuff like that, and for Christmas Eve especially. And I know some cystic fibrosis patients, they have like this vest. It's like a pneumatic
yeah.
vest. Have you ever used that before? Do you have that?
No, no, I've heard of them, but I've never had one or used one. No.
What has the doctor been telling you in terms of what the next step is going to be for you?
So January time, I was quite poorly. Um, there was word of a double lung transplant, but he did say that it's kind of a tick box process, and I don't fit the criteria for all the boxes just yet. For instance, I only have oxygen occasionally, and when I exercise, I'm not on it permanently at all. My weight is okay, my lung function is not great, but yet it's not within the danger zone just yet. um, he did say within a 2 year process it could happen. But then there's not been any talk of it again recently because I've kind of picked up a little bit. And then now this new medicine called the Trikafta is hopefully being going to be released in the UK within the next year and a half or so. They're very excited, my consultants and my professors that I have, and they've said to me that my criteria and my gene would fit everything towards the Trikafta. So hopefully, and fingers crossed, within 2 years, I might be able to start that and give that a go. And fingers crossed, I'll pick up my lung function on that.
So this
So
is
that's
very
yeah,
interesting actually because I was reading up a bit about the Trikafta. I'm
yeah,
I'm from the States, so I see a lot of
yeah,
things what's going on in the States. Currently, I'm in Scotland, and I don't know
yeah,
cystic fibrosis treatment options. Is like I don't know the differences between the two countries, but that's
yeah,
interesting that you said
yeah.
that it's not available here in the UK yet.
Yeah, it's not here just yet. So recently, and I mean recently within the last 6 months to a year, um, Orkambi and Simkevi have just been released on the NHS. So I am on Simkevi, but it's not really working for me. So I've had ups and downs. My doctors think, yes, it might be keeping me plateau, but yet it's not had any boost or increase within my lung function. So that is why they're kind of holding back. My top consultant professor guy, he just got back from America about 2 months ago, and he was saying that come next June, July onwards, hopefully this Trikafta will be available, and his life and workload will be halved just due to the fact that it's going to be that important for CF patients to be on.
Yeah, this Trikafta is It's
Yeah,
it's weird how much different it is from the Simkevi and the other one that you mentioned, because it
yeah,
almost has similar things to work with. It's just the
yeah,
Trikafta
yeah,
is like this triple therapy of a tezacaftor, ivacaftor,
yeah.
and another one that I can't even pronounce at the moment. And I'm also on Reddit, so, and I look at other people who talk about their cystic fibrosis just to get a better idea of what it looks like.
Yeah,
And the ones from the United States, they all say that they have the Trikafta and it's helped them so much. They did
yeah.
mention that there was like a purge in the beginning of a lot of coughs and like getting a lot
Yeah.
all that phlegm out and stuff like that. So I really hope that it gets here soon and that you can get
Oh,
your
I
treatment.
do. I do as well. Yeah. It's one of
Was there
those
ever
that.
I'm sorry,
Go on,
was
sorry.
there ever thought of you going to the States to try to get it there?
No. Never thought about it. Reason being, I'm on the Simkevi at the moment, and my doctors have just said just to hold on a little bit longer. There's no saying that if I was to go to the States, I would be able to get it because it's so expensive. It would have to be funded, hopefully through the NHS here, or sponsored, and we've not got that kind of money to go on a drug. So hopefully, we're just going to wait. Hopefully, for the NHS to pass it. My consultants have said due to the Orkambi and the Simkevi being passed on the NHS won't have a choice to pass the Trikafta, but as it's so good and the results and benefits are so much higher than the other two, so there's no question that it won't be on the NHS.
Well,
It's
we'll
just a
see.
matter of when.
Yeah, just when. Yeah,
Yeah,
hopefully it comes sooner than later. I wanted to turn
exactly. Yeah,
I wanted to turn this interview around a little bit to more of your personal life. I just wanted to ask, like,
yeah.
how is your relationship like with your friends, your family? How has that had any effect into your life as well?
Friends wise, it's not really had an effect. I've got a great bunch of friends. Um, Family are fantastic. I can't fault my family at all. My mum, she's like a superstar. She's always there for me, takes me back and to hospital. Um, I do drive, but when it's over an hour and a half away, and if they want to keep me in, then my car would be kind of isolated there. So she always takes me in. Regarding partners, I have had partners. I've had relationships. I think my longest one was about 3.5 years. But um, those ending, I wouldn't say they were anything down to CF. CF had a big part to play within the relationship, as you can imagine that my partner had a lot to take on board. It was not the easiest. It's not the most attractive when you're coughing up all your mucus. So no, it was very supporting when I was with her. But no, I'm very single at the moment, and I think that's partly my choice. I think at the minute I'm just kind of just a bit relaxed and yeah, just enjoying life as it is at the minute.
Do you have any big fears that you have coming up, or that in terms of cystic fibrosis, do you have any fears?
Um, I wouldn't say fears. No, the lung transplant was a fear, but I've kind of pushed that into the back of my mind, and I'm quite good at like switching off, just to blank things, and I kind of say to myself that I'll cross that bridge when I get to it. I do have a few issues like mentally preparing myself. For instance, like I'm a professional cricket coach, but that kind of gets put on the back burner a little bit just because of my days that I can work. And for instance, this year I've had 20 weeks in hospital. So I can't expect a professional cricket team to employ me knowing I'm having such a long period of time off work. So at the moment, I kind of work for it's what we call a minor counties cricket club. So you could say semi professional. And then I work a one-to-one basis with a lot of academy players. But my hours are a lot shorter compared to coaches that are of a better health.
No, that's definitely understandable, but it's nice to see that
Yeah,
you're doing something that you love because you mentioned you were playing cricket since you were about 10 years old or so.
yeah, yeah.
So that's really nice to hear. One thing I also wanted to ask, because it is a complication of cystic fibrosis, was there ever any talk between you and the doctor about having kids? Was that ever an issue as well?
Um, Not really had that conversation, to be honest. I've spoken briefly to my specialist nurses, but again with that I've kind of said we'll cross that bridge when we get to it. I've not been in a relationship long enough to go down that road as far, but I would love to have children. I'm a big family guy. I love children. So yeah, I would love to get that far one day, but at the moment I'm kind of just enjoying being me.
Just enjoying life
And
at the moment right now.
hanging.
What's in front of you now.
Yeah, yeah, just yeah, exactly.
And then when you meet new people
Yeah,
who might not be familiar with what cystic fibrosis is like, because seeing somebody with a nebulizer or just
yeah,
out of breath, that it can be a scary picture for somebody who's never even heard of it before. How do you want those
yeah,
people to treat you when you say, like, when they see you the way they see you, or
yeah.
they hear about it? How do you want them to look at you or treat you?
So ideally, I'd just like them to treat me for me as any normal guy. I've had relationships or girls that I've dated in the past that it's taken me a very long time to open up about it, and when I have, that's kind of been the end of the dating relationship. Um, in a way, I'm kind of glad they did it because I think that they're very narrow-minded, short-minded people. So I'd rather them do it there than wait 6 months down the line then do it. As a kid and a teenager into my early 20s, I hated talking about it. Never used to, apart from family, I never used to speak about it. I wouldn't say I was ashamed of it, but I was shy to think what other people think about CF. Um, in my hometown, I would say I'm quite well known, and a lot of people know I've got CF, but yet they don't know what it actually is, what it actually means, and what it contains. Because as a youngster, I've been quite healthy. They think they just think, oh, cystic fibrosis. James has got that, but yet he's quite well and he's quite healthy. They don't know what goes on behind closed doors. Um, so yeah, that's the way I would like to say is just treat me for me, get to know me instead of judging me as a CF patient or a CF sufferer.
Yeah, absolutely. It's one of those
Yeah,
things that can be sort of invisible if you don't show any symptoms out in public,
yeah,
because
completely.
most of the management and treatment is back at home with the medications and your
Yeah,
nebulizers and the PEP. So I wanted to ask you, now that it's been about 33 minutes into this conversation that we've been having, do you feel breathless now at all?
no, not when I'm sitting down. Um, like for instance, I'm just sitting on the sofa watching a little bit of telly. No, I don't feel breathless. Um, Going for a walk, depending on the incline, if I'm walking up a hill, potentially. Jogging is quite difficult now at the moment. So I would mostly go for like a brisk walk or make sure my walking is upstairs, up hills, just as a bit of extra resistance. But overall, yeah, I'm moving forward slowly.
That's good to hear. You know what, James, thank you so much. I have usually, for all of my patients, I have one more question. I usually save this to the end.
Yeah,
And this is basically
yeah,
um, for anybody who does have cystic fibrosis, um, that might be really down in the dumps and has no hope, or for people
yeah.
who know somebody that has cystic fibrosis, what kind of advice would you give those people in terms of going on with their journey of cystic fibrosis?
Okay, so for CF patients, I would say if ever you're feeling low, always talk to people, to someone close to you, somebody, family member or close friend. If that's not the case, then speak to your local hospital unit. There's always people you can talk to within that. Like, I went through a stage of being quite low, not feeling good enough, and didn't really want to speak to a family member, because, especially my mum, because I thought she does so much for me. I didn't want to put any more of a burden on her. So I spoke to a complete stranger within the hospital unit that I knew, and they were fantastic. They put me on the right path. They guided me. They gave me a boost of confidence, and yeah, I was not isolated out of anything. I was made to feel welcome with whatever I did, and that just got me straight back into everyday life, really. Friends of people, of CF patients, I would say, don't treat them any different. We're all human. We all like the things that you may like. We just do things maybe a little bit slower, or need to take time in between anything physical. But no, close friends and family is exactly what we need.
James, that was really great. Thank you so much for being a guest on this podcast and telling us your story and your journey of cystic fibrosis. I love your attitude, how you're very, I just want to do what's in front of me now, enjoy the moment
Yeah,
now.
definitely.
You don't dread about what might happen in the future. You don't think about it too much.
No.
It's a really great attitude. Keep it up. Keep it up. And I hope you do well. Stay strong. And I really hope this trikafta comes by much sooner than it should.
Thank you very much, and thank you for contacting me as well.
Is there anything else that you want to say?
Not really. I just like to say, wherever your podcast goes, could you send me a link so I can listen to it, please?
Absolutely. We'll do that.
Thank you very much, and you take care. Have a good Christmas.
You too, James. Thank you so much.
Cheers. Thank you. Bye-bye.
If you like this episode, please leave a review and also make sure to subscribe or follow on whatever platform you're listening to this on so you can catch the future episodes as well. If you want to be a guest on this podcast, please send me an email with a background of what disease you're living with to thepatientwillseeyounow@gmail.com, and I'll let you know if you're selected to be on the show. Don't worry if I haven't gotten back to you right away, because I might get you back for a later show. And if your condition was already mentioned on the show, no worries. I like to show how one disease can affect different people in completely different ways. Again, thank you so much for listening, and catch you next week.